Dear friends, today we are going to discuss about the non-amyloid deposition diseases. In the category of the non-amyloid deposition diseases, basically there are two types. One is the febrile glomerulonephritis and second is the immunotactoid glomerulonephritis. So if we talk about the febrile glomerulonephritis, the prevalence of the febrile glomerulonephritis is very less than 1% in the native kidney biopsy. If we do the native kidney biopsy, we found the only 1% of the cases of the febrile glomerulonephritis. The patient with febrile glomerulonephritis basically present with hypertension, may present with the proteinuria, CKD and hematuria. So the patients may present with the progressive CKD, the patient may present with the hypertension, and the patient may present with the proteinuria and hematuria. If we talk about the associated condition of the febrile glomerulonephritis, so these may be associated with the cancer, these may be associated with the autoimmune disease, and these may be associated with the infections and spondylitis. So if we talk about the cancer, febrile glomerulonephritis may be associated with the multiple myeloma. If we talk about the infection, may be associated with the hepatitis C, TB and osteomyelitis. If we talk about the autoimmune disease, may be associated with the SLE, Sjogren and ankylosing spondylitis. So these are the associated condition. So we are discussing the febrile glomerulonephritis, and these patients may present with the hypertension, proteinuria, CKD and hematuria, and may be associated with the cancer, may be associated with the autoimmune disease, may be associated with the infection. So what do we find in biopsy? So if we do the biopsy, so in light microscopy, basically we find the diffuse proliferative membranous mesengoproliferative glomerulonephritis picture, and basically we found the diffuse sclerosis and crescents may be rare. So in light microscopy, usually diffuse proliferative mesengoproliferative feature may be there, maybe diffuse sclerosis and maybe the crescents, and the crescents may be rare. But if we do the immunofluorescence, in immunofluorescence basically IgG 1 and 4 are mainly found, and beside this kappa and lambda light chains with complements may be there. So this is about the light immunofluorescence finding. If we talk about the electron microscopy, we usually find the randomly arranged fibrils in the electron microscopy. The cases of the febrile glomerulonephritis usually reach to end-stage renal disease in 40 to 50% of the cases, usually reach to the end-stage renal disease. So this is about the febrile glomerulonephritis, and this is the non-amyloid deposition disease. The second one is immunotactoid glomerulonephritis. If we talk about the immunotactoid glomerulonephritis, the prevalence is very less of the immunotactoid glomerulonephritis. If we do the native kidney biopsy, and we usually find the 0.06% of the cases of the immunotactoid glomerulonephritis, and the patient may present with the hypertension, proteinuria, CKD and hematuria may present. Now the associated condition may be the lymphoproliferative diseases, HIV and hepatitis C virus may be associated with the disease. If we see the light microscopy in immunotactoid glomerulonephritis, we usually find the membranoproliferative and diffuse proliferative glomerulonephritis features or picture. And if we see the immunofluorescence, IgG or IgM, monoclonal kappa or lambda chains, light chains and complements may be there. So this is the immunofluorescence microscopy. In electron microscopy, there are microtubules, and 15 to 20% of the patient usually do reach to the end stage renal disease. So these are the this is about the immunotactoid glomerulonephritis. So these are the non-amyloid deposition diseases. One is the febrile glomerulonephritis, and the second one is the immunotactoid glomerulonephritis.